Yeah, I suppose being healthy to me is all about staying positive and a lot about perspective and so that, because yes, I'm in a difficult situation being in a wheelchair and having the condition that I do. I have cerebral palsy, but I would also describe that as being differently abled. So just because I'm in a wheelchair doesn't necessarily mean that I can't experience the same things as anyone else. Maybe not in exactly the same way, but definitely in some form.
I think it's important to say that mental health, similar to physical health, is a spectrum, and we can go from a place of poor mental health to very good mental health. And any day we can find ourselves on either end or in the middle of that spectrum.
If my mental health is down, I have a bad performance in anything, like in physical, sexual, or in social.
Yeah, so like anybody else, I go through the days where I'm not feeling fantastic about myself or situation, or my mind is racing. For example, recently I started a new job and it involves a lot of change. It's very challenging, a bit of travel abroad and things like that, and I found myself just waking up with really bad anxiety that I hadn't had for years. For me, over the last couple of years in particular, when I faced a lot of adversity, it was important to have sort of routines that I can go to in terms of things that help my mental health.
I would try my best to kind of organize my mind. Okay, what do I need to do today? How will I achieve that? You know, it's kind of like setting targets.
To write something down is 10 times better than to keep it in, because once you write it down, it's out there. But then you do whatever you want with that piece of paper. You've written it down, you've got it out of your system, you've got all the negativity out, and your depression, your anxiety, it's all been cleared. It's on that piece of paper. You can burn it, you can send it to someone, you can do whatever with it. To know that you've cleared it, you've written it down, like, it's 10 times better because you've gotten it out.
You can't always do it by yourself, and that, first of all, is quite sobering when you realise it, but secondly, it creates a challenge, because now you realise that you're vulnerable like everybody else, and you have to bring yourself to reach out for a bit of help. And it's something that we all have to do at some stage, and you have to understand that that is totally okay.
The first protocol is always somebody you trust. Don't be scared of being a burden to somebody else, because that's the furthest thing from the truth. Because as I said earlier on, it's, you know, a problem shared is a problem halved, and it is a cliche, but it is the truest cliche. The most important thing is making the time and taking the time to look after you, because at the end of the day, that's most important.